This is the second video for the P1 in which we are talking about the MCQs of the respiratory system. First question here in front of us, a 31-year-old soldier to receive our shrapnel wound in the neck during the Persian Gulf War. So first thing we got here, the wound in the neck. Okay. Recently during a physical examination, it was noticed that when he blew his nose or sneezed, forceful action, okay, the skin above the right clavicle bulged upward. So the skin above the clavicle is bulging up during this sneezing or blowing his nose. What we need to do, we need to find the reason why this bulging is happening. So one from here will be the best answer to explain it. Injury to the cervical pleura. Maybe damage to the suprapleural membrane could also be. Damage to the deep fascia. Now this one will not do this. Ununited fracture of the first rib. First rib fracture will also not do this kind of stuff because the first rib is covered with the clavicle. Now let's go to the picture to have a look. This is the cervical pleura. This will not be damaged because it is also covered with the clavicle. So the damage will happen to the suprapleural membrane, which is also attached here. So the best answer will be the B, damage to the suprapleural membrane, which normally prevent the cervical dome of the pleura from bulging up into the neck. Now we go to the next question. A 52-year-old woman was admitted to the hospital with the diagnosis of the right side pleurisy with pneumonia. It was decided to remove a sample of the pleural fluid from her pleural cavity. The resident inserted the needle close to the lower border of the 8th rib. In the anterior axillary line. In the next morning, he was surprised to hear that the patient had complained of altered skin sensation extending from the point where the needle was inserted downward and forward to the midline. So you see that from point of insertion to the downward and forward to the midline of abdominal wall above the umbilicus. So this pattern actually is showing the passage of the nerve. Let's see. The altered skin sensation in this patient after the needle thoracotomy could be explained by which of the following? So this sensation change. So first of all, we will see here the needle was just too low down into the intercostal space. Nothing related. The needle was inserted too close to the lower border of the 8th rib and damaged the 8th intercostal nerve because that is the passage, lower border of the rib. So that could be the possible, we can see after a moment. The needle had implanted the 8th rib. If it is the rib, then it will not show this kind of thing on the skin. The needle had penetrated too deeply and pierced the lung. Actually, if it is the lung, then it should not go up to the umbilical toward that side. So that is also not. So possibly, it is the B. Let's see that. You see that if the lower border of the rib here insert, then it can damage the intercostal nerve. So the passage of the intercostal nerve from sideway, you can see going downward direction, so that it could happen that damage the intercostal nerve. So you can choose the B as the correct answer. Now we can go to the next question. Question number 3. A 68-year-old man complained of a swelling in the skin on the back of the chest. Swelling, back of the chest. He had noticed it for the last 3 years and was concerned because it was rapidly enlarging. On examination, a hard lump was found in the skin in the right scapular line, opposite to the 7th thoracic vertebra. A biopsy revealed that lump was malignant. So here we got something related to the lymphatic portion, and biopsy showing is malignant because of the rapid increase in the size of the tumor. The following lymph nodes were examined for metastasis. So this is the posterior side. The scapular line is present on the back side. So what kind of lymph node should be present on that? So we got here superficial inguinal lymph node. They are in the lower limb. Anterior axillary, they are present anteriorly at the anterior. Scapula is present posteriorly. So that is also not. We got here the posterior axillary, that may be external iliac present in the lower limb, deep cervical lymph node present in the neck. So possibly we are coming to the answer C, because here we go to the posterior axillary lymph node, those are close to the backside. So let's see that. Here we go to the scapula, and here we go to the posterior axillary lymph node. So our correct answer is the C. Now we go to the next question. Question number 4. A 65-year-old man and a 10-year-old boy, so the age, were involved in a severe automobile accident, and both patients' works had been badly pushed. Radiographic examination revealed that the man had 5 fracture ribs, but the boy had no fracture. Why this happened? What is the most likely explanation for this difference in the medical finding? Let's see here. The patient were in different seats in the vehicle. No, this could not be the reason. The boy was wearing his seat belt and the man was not. No. There is no anything like this here. The chest wall of a child is very elastic, and a fracture of the ribs in children are rare. This is possible. The man anticipated the impact and tensed his muscles, including those of the shoulder girdle and abdomen. No, this doesn't do like this. So mainly we can see that the age of the boy and the age of the old man. So this is possibly the C. The chest wall of the child is very elastic. So C will be the best answer to explain this kind of medical finding. We go to the next question now. Question number 5. On examination of the posterior anterior chest radiograph on an 18-year-old woman, it was seen that the left dome of the diaphragm was higher than the right dome and reached to the upper border of the fourth rib. The position of the left arm of the diaphragm could be explained by the following except. So when the except comes, it means that you need to find out one wrong information. So there are 5 A, B, C, D, E. So we need to find out which one is the wrong answer here. So let's see, the left lung could be collapsed. Possible. Left arm is higher, so possible. There is a collection of blood under the diaphragm on the left side, also possible. There is an big abscess in the left lobe of the liver, also possible. Left lobe is coming to the left side. The left dome of diaphragm is normally higher than the right dome. No, this should not be like this. Mostly, in general, normal patient, the right side, the right dome is higher due to the location of the liver there. So this seems to be a little bit. Then go to the next. There is a peritoneal abscess beneath the diaphragm on the left side. So all these are supporting the left side, but this one is saying something different. Let's have a look here. In general, right dome is a little bit higher as compared to left due to this space is captured by the liver. So this is saying wrong information here. So we will choose the except here D. So for question number 5, the answer is the D. Go to the next. Question number 6. A 33-year-old man was involved in a violent quarrel with his wife over another woman. In a fit of rage, the wife picked up the carving knife and lunged forward at her husband, striking his anterior neck over the left clavicle. The husband collapsed on the kitchen floor, bleeding profusely from the wound. Struck life called for an ambulance. On examination in the emergency department of the hospital, the following conditions were found except. Again, one is wrong here. A wound was seen about over the left clavicle, then it is okay. It is knife, it can make this much. Auscultation revealed diminished breath sound over the left hemithorax. Possible. Because the left side hemithorax, then the trachea was deflected to the left. Possible. The left upper limb was lying stationary on the table, and active movement of the small muscles of the left hand was absent, possibly touching the brachial plexus. This could also be happened. The patient was insensitive to pinprick along the lateral side of the left arm, forearm, and the hand. This one seems to be a little bit, because it's showing the small movement already, so that it should not be. So we will choose the E as the exception. Why? Because this wound explained to loss of movement of the small muscles of the left hand. It would also explain the loss of skin sensation that occurred in the CA to T1. But the dermatome on the medial, not on the lateral, side of the left forearm and hand. So the knife had also pierced the left plumb of the cervical pleura, causing a left pneumothorax, and also the diminished breath sound with the deflection of the trachea to the left. So this is the best answer, as we see that the knife is approaching and then hitting this area and also damaging the brachial plexus. Next question, question number 7. A 72-year-old man complaining of burning pain on the right side of his chest. Burning pain on the right side of his chest was seen by the physician. On examination, the patient indicated that the pain passed forward over the right 6 intercostal space from the posterior axillary line. As far as the midline over the sternum, the physician noticed that there were several watery belts on the skin in the painful area. So we got here the except again. It means one is wrong. So bubbles we found and showing the way of the nerve passage. So it may be the abscess virus. The virus descends along the cutaneous nerve, causing the dermatomal pain and the eruption of the vesicles. Also possible. The 6th right intercostal nerve was involved, as it is saying the 6th intercostal space, so also okay. The condition was confined to the anterior cutaneous branch of the 6th intercostal nerve. Confined to the anterior cutaneous branch, but it is coming from the right side of the chest as seen by physician to the posterior to anterior. It is almost so. This is looking a little wrong information. They said that the skin over the 6th intercostal space is innervated by the lateral cutaneous branch, and here is talking about the anterior. So that is a trouble. So D is the best answer. We can also look at the picture. As we can see here, this side we are having a lateral branches for intercostal nerve. So anterior one is here. Innervation is taking up the anterior. So in this place, having this kind of branches, it's belong to the lateral or the posterior portion, but not the anterior. Question number 8 now. In the question number 8, we got here an 18-year-old woman was thrown from a horse while attempting to jump a fence. She landed heavily on the ground, striking the lower part of her chest on the left side. On examination in the emergency department, she was conscious but breathless. The lower left side of her chest was badly bruised, and 9th and the 10th ribs were extremely tender to touch. She had severe tachycardia, and her systolic pressure was low. So, except again in this. So, one information is wrong. So that we need to find out that what is wrong in this equation. Tenderness and muscle spasm in the left upper quadrant of anterior wall. Evidence. The posterior anterior radiograph of the chest revealed fracture of the left 9th and 10th ribs. Also possible. So tender is mean fracture. The blunt trauma to the ribs had resulted in the tear of underlying. When blunt trauma happens, spleen will burst the first organ. The presence of the blood in the peritoneal cavity had irritated the vital peritoneum, producing the reflex balance of the upper abdominal muscle possible. The muscles of the anterior abdominal wall are not supplied by the thoracic spinal nerve. This is wrong information. So our exception is here. So let's go to the picture. You can see that here we are having the innervation of abdominal from T6 to T12. They are all T representing the thoracic, so they are innervating the anterior abdominal wall. So here we got the E as the correct answer. Next, here we go to question number 9. A 55-year-old man states that he has noticed an alteration in his voice. He has lost 18 kilograms and has a persistent cough with blood-stained sputum. Smoke 50 cigarettes a day. On examination, the left vocal fold is simplified and lies in the adducted position. A posterior anterior chest radiograph reveals a large mass in the upper lobe of the left lung with an increase in the width of the mediastinal shadow on the left side. Large mass, the lobe of the left lung going into the mediastinal shadow. The symptoms and signs displayed by this patient can be explained by the following statement, except. So when the except comes, you need to find out which one is the wrong statement from this. So we got here, the patient was advanced carcinoma of the bronchus in the upper lobe of the left lung, which was seen at mass on the chest radiograph, something seen, so possible. The carcinoma has metastasized to the bronchomediastinal lymph node, causing the enlargement and producing a widening of the mediastinal shadow seen on the radiochest graph is also possible. A large lymph node had pressed on the left recurrent pharyngeal nerve. Possible. Partial injury to the recurrent pharyngeal nerve resulting in the paralysis of the abductor muscles of the vocal cord, leaving the abductor muscles unopposed. Possible. Then the last, the enlarged lymph node pressed on the left recurrent nerve, very similar to this one, as it ascends to the neck anterior to the heart. It is anterior to the heart. So this is the wrong information here, which we need to find out. So let's go to the picture to see that here, as it is going under the aortic arch and going upward then. And when it's going upward, then it is between the, you can see here the trachea and the esophagus. So here we go, the left recurrent pharyngeal. So the duration of this is not shown. So the correct answer will be the E here. Let's go to the next question here, question number 10. A 35-year-old woman had difficulty breathing and sleeping at night. She says she falls asleep only to wake up with a choking sensation. She finds that she has to sleep propped up in bed on pillow with her neck flexed to the right. Following statement is correct except again. Let's go on. The veins in the neck skin at the root of the neck are congested. So the U-shaped cartilaginous string in the wall of the trachea prevent it from being kinked or compressed. This is a little bit, so we will see later on. The left lobe of the thyroid gland is larger than the right lobe. Correct. On falling asleep, the patient tends to flex her neck laterally over the enlarged left thyroid lobe. So here is showing that going to right. So this left ventricle too. Then she's having the problem, right? The enlargement thyroid gland extends down the neck into the superior mediastinum, correct? The bronchocephalic. The brachycephalic vein in the superior mediastinum were partially obstructed by the enlarged thyroid glands. Possible. So just only this part here, the trachea is in fibroelastic tube that can be hindered or compressed despite the presence of the cartilaginous remnant. So here is saying that prevent. So that is the information we need to plug out here. So the answer will be the B. Okay, the trachea. Let's go to the question number 11 now. A 15-year-old boy was rescued from the lake after falling through thin ice. The next day, he developed a severe cold. 3 days later, his general condition deteriorated. He became febrile and wanted to cough up blood-stained sputum. At first, he had no chest pain, but later, when he coughed, he experienced severe chest pain over the right fifth intercostal space in the mid-clavicle. So which statement is showing a sign system except? Again, one is wrong. Pardon. The patient had developed lobar pneumonia and pleurisy in the right lung, as we are here on the right, so the right. So this is okay. The disease of the lung does not cause pain until the plantar pleura is involved. Is correct, because the lungs and the visual pleura is not having the sensation of the pain. The pneumonia was located in the right middle lobe, right side middle lobe, possible, because it's showing that fifth intercostal space, almost the location. The visual pleura is innervated by the autonomic nerves that contain the pain fiber. This is not correct. So what we were looking for is this one, because visual pleura is not having the pain sensation. So here the pain associated with the pleurisy was accentuated when movement of the visual and the plantar pleura occurred, for example, a deep inspiration or the cough. This information is also correct. So which one we are looking? That is the D. Is the correct answer for this. As we can see here, first, second, third, fourth, and the fifth. The fifth intercostal space almost here at the mid clavicle line. So this is the location of the middle lobe. Right side. Question number 12. A 2-year-old boy was playing with his toy car when his babysitter noticed that a small metal nut was missing from the car. 2 days later, the child developed a cough and became febrile. This child illness could be explained by the following statement, except again, one is the correct. The child had inhaled a nut that is missing probably. The metal nut could easily be seen on posterior anterior and right oblique radiograph. Sure. The left principal bronchus is more vertical. This should not be like this. So we will come back here. The nut was successfully removed through the bronchoscopy. Bronchoscopy we use to remove this kind of stuff. Children who are teething tend to suck on hard toys. Yes, it is also correct. Now let's see. To know about this answer, let's see that the left side is more horizontal, right side is more vertical, narrower in the diameter here, and here the right side the diameter is more wider. So when the things will inhale, mostly it will go to the right side. So the correct answer is here C, which is saying that the left principal compass is more vertical. No, no, that is more horizontal and narrow. Let's go to question number 13. A 23-year-old woman was examined in the emergency department because of a sudden onset of respiratory distress. The physician was listening to the breath sound over the right hemispheres and was concerned with no sound were heard on the front of the chest at the level of the 10th rib in the mid-clavicle line. Again, the statement is with the except. So we need to find out which is the wrong statement here. In a healthy individual, the lower border of the right lung in the mid-clavicular line in the mid-respiratory position at the level of the 6th rib. Correct. It is up to the 6th. The parietal pleura in the mid-clavicular line crosses the 10th rib. This we need to see a little bit. The costodiaphragmatic recess is situated between the lower border of the lung and the parietal pleura. Right. The lung on extreme inspiration could descend in the costodiaphragmatic recess only as far as the 8th rib. Right. No breath sound were heard because the stethoscope was located over the liver. Correct. Front of the chest at the level of 10th rib. Have a look. Anteriorly up to the 7th, and then after that it is here, this part we are having the liver. So what is happening here? The parietal pleura in mid-clavicular line crosses the 10th rib. Parietal pleura, mid-clavicular. Mid-clavicular line, here we go. And here we are having parietal pleura. It says that anteriorly here mid-clavicular line 10th rib, but it just only goes to the 8th rib. So this one is the wrong answer, which one we need to find. So here is the B, which is the answer. Because the parietal pleura in the mid-clavicular line only extend down as far as 8th rib. Question number 14. A 36-year-old woman with a known history of lymphoma suddenly experiences severe pain in the left side of her chest, is breathless, and is obviously in the state of shock. Severe pain in the left side of her chest, breathless, state of shock. Again, except. We got here, the trachea is displaced to the right in the supraesternal notch. Possible. Breathless could be anything. The apex beat of the heart can be felt in the fifth intercostal space just lateral to the sternum. Correct. The right lung is the S. Pain is on the left side. So we will come back to this. The air pressure in the left ear cavity is at atmospheric pressure possible, because if I am not patient, could have this. The air has entered the left rear air cavity as a result of the rupture of one of the emphysematic of the left lung, also possible. The elastic recoil of the lung tissue caused the lungs to collapse, possible. So here the right lung, the whole story is happening to the left side, and here the right lung is saying about the collapse. So C is the which will we need to find as exception. Actually, it should be the left lung collapse. Then the air entered in the left pleural cavity. Because they are separate cavities for the left and the right side. So 14th question, and thank you up to here. To making these movies is causing a lot of time, but without explanation, if I give you this material, it is no use. So thank you very much for bearing and understanding this part. Thank you very much.